Diabetes does not end with a simple blood sugar issue. It causes various serious complications that can have a profound impact on the entire body. First, cardiovascular complications. Diabetic patients tend to experience an earlier onset and more severe progression of atherosclerosis and calcification of arterial walls. This significantly increases the risk of heart attacks or strokes. Notably, peripheral artery disease occurs 50 to 100 times more frequently in diabetics than in healthy individuals. This issue arises as excess fat accumulates in the blood vessels. Interestingly, it is highly likely that diabetic patients were suffering from atherosclerosis even before the onset of diabetes. This is because the fundamental causes of both diabetes and atherosclerosis are the same: a diet high in fat and sugar, lack of exercise, and unhealthy lifestyle habits. Second, microvascular disease. It is common for diabetic patients to experience thickening of the capillary membranes in key areas of the skin and skeletal muscles. This is particularly evident in the retina of the eyes and the glomeruli of the kidneys, which can eventually lead to blindness or kidney failure. Third, ketoacidosis. When insulin is insufficient, the body attempts to break down stored fat to use as fuel. In this process, ketone bodies are excessively formed, lowering the pH of the blood and causing acidosis. The consumption of acid-forming foods, such as meat, dairy products, refined flour, and refined sugar, further exacerbates this problem. As such, we must remember that diabetes is not a disease localized to a single organ, but a systemic disease that affects the entire body. One should not assume their health has improved simply because blood sugar levels have been suppressed. Many people believe that once diagnosed with diabetes, they must rely on medication for the rest of their lives, but this is not necessarily true. By choosing a healthier way of life, it is entirely possible to lead a healthy life without medication. Of course, if one has been dependent on insulin for a long time, the dosage should be gradually reduced through consultation with medical professionals. In cases where the function of the islets of Langerhans is completely damaged, a trace amount of insulin may be necessary. However, transitioning to a healthy lifestyle allows one to maintain a much better condition than the average diabetic patient and escape from degenerative diseases associated with diabetes. As Dr. Vitrano said, if the functional tissue is in good condition, health can be restored and maintained. This is because our bodies possess an incredible ability to heal themselves. Recovery occurs when the cause of the disease is removed. By reducing the intake of harmful animal products and practicing a plant-based diet, specifically a vegan diet consisting of fruits, vegetables, nuts, and seeds, you can eliminate toxins while providing proper nutrition. This removes the root cause of the disease and allows for the recovery of health. Insights from renowned medical experts. Prominent doctors who practice veganism themselves emphasize the benefits of a plant-based diet. Dr. Neal Barnard. Our research shows how a vegan diet benefits diabetic patients. A vegan diet leads to weight loss and a drop in cholesterol and blood sugar levels. Many people have moved away from medication, and their blood pressure has also decreased. Dr. Gabriel Cousens. We have a 21-day program. It allows patients to stop insulin and all diabetes medications in just 1 day. In 2 to 3 weeks, blood sugar levels that were 400 to 500 recover to a normal level of under 100. Dr. Brian Clement. I have never seen a case of type 2 diabetes that is incurable. Lifestyle choices are the key. If you practice a vegan diet, exercise, and do not consume sugar, you can be free of diabetes. All of these diseases can be cured. Furthermore, a large-scale 2013 study by Tonstad and 5 others, titled Vegetarian Diets and Incidence of Diabetes in the Adventist Health Study 2, analyzed and compared groups of vegans, lacto-ovo vegetarians, semi-vegetarians, and non-vegetarians. The results found that the more strictly a plant-based diet was followed, the more the incidence of diabetes decreased step by step. Additionally, this study revealed that the incidence of hypertension and excess body fat also lowered as one moved closer to a pure vegan diet. It proved that the vegan group, consuming only plant-based foods, was the only group that was not overweight on average. In conclusion, a vegan diet can be an extremely powerful tool in preventing and managing diabetes.